Imagine if one simple mineral could unlock better sleep, reduce anxiety, and boost your energy. Magnesium might just be that missing link. But with so many different forms of magnesium out there, how do you choose the one that's truly worth it for your health goals? Today, I'll break down the different forms of magnesium, why they matter, and how to choose the best one for you. And at the end, I'll share my personal 2-axis guide for understanding how to pick the right magnesium supplement for your purposes. I'm Dr. Hilary Lynn, a physician and longevity specialist. If you've been feeling tired, stressed, or out of balance, it might be time to focus on magnesium. Now let's dive into why this essential mineral could be a game changer for your health and longevity. Magnesium is one of the most essential minerals for our bodies, yet it often gets overlooked in favor of more talked about nutrients like calcium or vitamin D. But here's the thing, magnesium is a true powerhouse involved in over 300 biochemical reactions in your body. It impacts everything from muscle and nerve function to regulating blood pressure and supporting your immune system. Without enough magnesium, your body simply can't perform at its best, and that's a big deal. Think of magnesium as the unsung hero that keeps all the gears of your body running smoothly. Picture a car engine. Magnesium is like the oil that keeps every part moving efficiently. It plays a crucial role in muscle relaxation, which makes it a must-have for anyone dealing with muscle cramps or tension. Whether you're an athlete pushing your limits or someone who gets those annoying nighttime leg cramps, magnesium can be a real game changer by helping your muscles relax and recover more effectively. Magnesium helps the body remove lactic acid buildup, which can reduce muscle soreness after a workout, making it invaluable for both performance and recovery. But that's just the start. Magnesium is incredibly important for your mental well-being. It acts as a natural relaxant, helping to regulate neurotransmitters in the brain and promoting a sense of calm. You can imagine magnesium as your brain's calming assistant. It's like a yoga instructor, making sure everything runs smoothly behind the scenes. And in times of stress, your body actually uses more magnesium, which means that the more stressed you are, the more likely you are to be deficient. It's almost like your stress is burning through your magnesium reserves. So if you're dealing with anxiety, poor sleep, or mood swings, magnesium might just be that missing link that helps you feel like yourself again. Magnesium deficiency has also been linked to neurological symptoms like migraines, depression, and anxiety. It's fascinating how this mineral plays a role in regulating ion channels and neurotransmitters. Essentially, it helps keep your brain's signals firing the way they should. In older adults, magnesium deficiency can worsen cognitive decline and sleep disturbances, which are often mistaken for normal aging or even dementia. It's not just about feeling relaxed, it's about maintaining the clarity and vitality of your mind as you age. And it doesn't stop there. Magnesium is also a major player in cardiovascular health. It helps maintain a steady heartbeat and supports healthy blood pressure levels, which are foundational for long-term heart health. Imagine magnesium as the conductor of an orchestra, making sure your heartbeats are in perfect rhythm. Studies show that people with higher magnesium levels tend to have a lower risk of developing conditions like hypertension and cardiovascular disease. Pretty amazing. So when you don't get enough magnesium, it can disrupt the electrical impulses that keep your heart rhythm steady, leading to dangerous arrhythmias. It can also increase peripheral vascular resistance, basically making it harder for your heart to pump blood through your vessels, which can raise your blood pressure. This makes magnesium crucial for maintaining a healthy cardiovascular system and preventing potentially life-threatening issues. Magnesium also plays a crucial role in managing your blood sugar by improving insulin sensitivity, which is a huge benefit for anyone concerned about metabolic health or managing conditions like type 2 diabetes. Imagine magnesium as the key that helps unlock your body's ability to use insulin effectively. Chronic magnesium deficiency is linked to metabolic disorders, such as type 2 diabetes and metabolic syndrome, because of that link to glucose and insulin metabolism. When your cells become less responsive to insulin, your blood sugar levels can spiral out of control, but magnesium helps keep that process in balance. It's truly a multitasker, helping your heart, muscles, brain, and even your metabolism stay in top shape. Magnesium also has powerful anti-inflammatory and antioxidant properties. A deficiency can lead to increased oxidative stress and inflammation, which are underlying factors in the development of many chronic diseases, including cardiovascular disease and diabetes. You can think of inflammation as a small fire that can smolder within your body, causing damage over time. Magnesium acts like a firefighter, helping to put out those flames before they spread. By keeping your magnesium levels in check, you're not just supporting one system, you're helping your body fight off inflammation and reduce the risk of chronic illnesses. Here's the problem. Many people are deficient in magnesium without even knowing it. Modern farming practices have led to significant depletion of magnesium in the soil, largely because chemical fertilizers often focus on nutrients like nitrogen, phosphorus, and potassium, leaving magnesium behind. This means that even if you're eating a balanced diet, you might not be getting enough of this vital mineral. Add in stress, poor absorption, or excessive caffeine or alcohol intake, and you've got a recipe for widespread magnesium deficiency. The bottom line, magnesium matters because it's a foundational building block for your overall health. Addressing a magnesium deficiency can lead to better sleep, improved mood, enhanced athletic performance, and more balanced blood sugar levels. It's a small addition to your routine that can lead to truly life-changing improvements across the board. So we know that magnesium is essential for virtually every function in your body, from muscle relaxation to heart health, and even keeping your brain in tip-top shape. But before diving into the types of magnesium supplements and how to pick the right one, it's important to understand where you currently stand. Are you getting enough magnesium, or are you one of the many people who are deficient without even knowing it? The best way to answer that question is through accurate testing. Testing your magnesium levels can be a game changer for taking control of your health. Magnesium deficiency often flies under the radar because its symptoms, fatigue, muscle cramps, anxiety are so common that they can be easily attributed to other causes. The truth is, magnesium is involved in over 300 enzymatic processes, and a deficiency can have wide-reaching impacts across multiple systems in your body. By testing, you can make sure that you're not missing out on the full benefits of this vital mineral. What's more, the body's magnesium reserves are largely stored in bones and soft tissues, which makes it really hard to gauge how much you have simply based on dietary intake or how you feel. So testing helps provide a clearer picture of your true magnesium status, allowing you to make informed decisions about supplementation. There are several ways to test magnesium levels, but it's important to note that not all tests are equally effective. And even doctors get this wrong because, again, we don't learn enough about supplements and nutrients in medical school, unfortunately. So here's a rundown of the different methods, what they measure, and how reliable they are. First, the most commonly available test is the serum magnesium test. This measures the amount of magnesium in your blood serum at the given point in time. So while this is the most widely used method, it has a major limitation. Only about 1% of your body's magnesium is found in the blood, and the rest is stored in bones and cells. As a result, a normal serum magnesium level doesn't always mean you have adequate magnesium overall. Serum levels can be maintained at the expense of cellular magnesium, giving a false impression of sufficiency. This is because the serum levels are vitally important for those cardiac electrical impulses. Without the proper amount of magnesium in your blood at any given time, your heart might not beat normally, so it's super important, and your body will sacrifice the cellular supply of magnesium so that your blood supply is adequate. This is really helpful in the hospital and in the ICU where we're dealing with life-threatening situations moment to moment. But for the rest of us not currently hospitalized, it's not actually that practical. And honestly, in my practice, I almost never see abnormal serum magnesium results, except in patients with severe end organ disease. It's a useful starting point, but definitely not the most definitive test. A much more accurate way to assess magnesium status overall is the red blood cell magnesium test. This measures the magnesium content inside your red blood cells. Since red blood cells can reflect longer-term magnesium stores, this test gives a better indication of the body's actual magnesium reserves compared to a serum test. The RBC test is practical, and it can be done at most general labs, making it the most reliable and accessible option for most people. In my practice, which focuses on longevity, I make it a point to check RBC magnesium levels at least annually to stay ahead of any potential deficiencies. But you can actually test this every quarter because that's about how long a red blood cell survives. And it's the theory behind why we also check hemoglobin A1C for people who are worried about their blood sugar levels every 3 months. The magnesium loading test is considered one of the most precise ways to assess magnesium deficiency, particularly in people who may have severe depletion. In this test, magnesium is administered intravenously, and then the amount excreted in the urine is measured. If very little magnesium is excreted, it means your body is holding on to as much as possible, indicating a deficiency. However, this test is pretty impractical for everyday use, and most doctors don't go quite this deep unless there's a significant clinical concern. It's very effective for uncovering deeper deficiencies, but not typically necessary for most people. And just to mention it, another option is hair mineral analysis, which measures magnesium and other minerals in a sample of your hair. So while this can provide some insight into mineral imbalances, it's not considered the gold standard for magnesium testing. Hair tests can be influenced by factors like hair treatments, environmental exposure, and even shampoo residue, which makes the results less reliable compared to blood or loading tests. You might be wondering now when it makes sense to test your magnesium levels. So here are some scenarios where it's a good idea to ask your doctor for a test. If you're dealing with chronic fatigue, muscle cramps, irritability, anxiety, or headaches, a magnesium deficiency could be the culprit. And also, people with conditions like diabetes, hypertension, or heart disease may have increased magnesium needs and could benefit from testing to ensure they're not deficient. Certain medications, such as diuretics, proton pump inhibitors, which you use for acid reflux, and even some antibiotics, can deplete magnesium over time. Testing can help you determine whether supplementation is necessary. Also, if you're an athlete or someone who works out frequently, your magnesium requirements are higher. Testing can help you understand if your current intake is meeting your body's increased demand. And again, in my longevity-focused practice, I recommend testing magnesium levels at least annually, particularly using the RBC magnesium test. It's a really easy way to catch potential deficiencies early and make sure you're supporting your body as effectively as possible. And once you have your magnesium test results, it's time to put them to good use. If you find that your levels are low or borderline, it might be time to consider supplementation or dietary changes. But remember, supplementation is not one size fits all, and that's where choosing the right type of supplement comes to play. The type of magnesium you take can greatly influence how well your body absorbs and utilizes it, which is why picking the right supplement is crucial. For example, if your deficiency is related to stress and sleep disturbances, magnesium glycinate might be your best bet. On the other hand, if you're experiencing muscle cramps, magnesium citrate or malate might be more effective. Now that we understand just how critical magnesium is for your overall health, the next big question is, how do you get enough of it? My usual answer for most nutrients is to get it from food, but like we covered earlier, there's simply not enough of it in our typical plant sources these days, so we need to turn to supplements. But supplementation is not that simple. The truth is, not all magnesium supplements are created equal. When you go to the pharmacy and you're in the supplement aisle, you might see bottles labeled with names like magnesium citrate, glycinate, malate, or threonate, and you're wondering, why are there so many options? Well, each type of magnesium has a unique way of interacting with your body, and each one serves a different purpose. Magnesium is an unstable element on its own, which means it needs to partner, often called a chelate, to help stabilize it for use in your body. The compound that magnesium is bound to determines how well it's absorbed, where it goes in your body, and ultimately what it helps with. Some forms are better absorbed by the gut, while others are crafted to cross into the brain or even work directly within muscle cells. The bottom line is that the partner molecule can make or break whether the magnesium is effective for what you need. So which one is best? The answer really is, it depends on you. So let's dive in and explore the most common types, what makes each one special, and how they can address your specific health concerns. First, magnesium citrate is one of the most popular forms, and for good reason. Imagine magnesium bound to citric acid, which helps it be highly absorbable by your body. This form is commonly used to relieve constipation, thanks to its gentle laxative effect. If you're someone who deals with occasional digestive issues and you want to keep things moving smoothly, magnesium citrate could be your new best friend. Just be mindful that it may cause some mild digestive discomfort if your stomach is a bit sensitive. Magnesium citrate, however, isn't just for keeping your digestion in check. For people with coronary artery disease, supplementing with magnesium citrate at 365 milligrams per day for 6 months improved their exercise tolerance and even reduced their chest pain. There was also a pilot study that suggests that magnesium citrate at 200 milligrams a day could help reduce restless leg syndrome and improve quality of life. We also often use magnesium citrate for bowel prep before colonoscopies, although it's not for people with chronic kidney disease. So remember to tell that to your doctor if you're preparing for a colonoscopy. Next up is magnesium glycinate. This is my go-to for anyone struggling with stress, anxiety, or sleep issues. Magnesium glycinate is a magnesium bound to the amino acid glycine, which is known for its calming properties. Think of it as a gentle, calming hug for your nervous system. It's highly bioavailable, which means it's easy for your body to absorb and it won't upset your stomach. If you're feeling stressed, struggling to wind down at the end of the day, or just want to improve your sleep quality, this one is worth considering. There are some interesting insights we've learned from studies. So it turns out that long-term use of magnesium glycinate can decrease intestinal motility, which might actually lead to symptoms like bloating or constipation if taken for too long. So this is a complete opposite effect of the magnesium citrate. Magnesium glycinate has also been associated with reductions in inflammation. So it'll lower levels of C-reactive protein, which you can test for on your regular blood test, and it can increase your nitric oxide levels, which can help with overall inflammation control. And if you're dealing with high blood pressure or blood sugar issues, magnesium glycinate can help improve these metabolic parameters, showing benefits for people at risk of diabetes. Now let's talk about magnesium threonate. This one is the new kid on the block, but it's already making some waves. You might know of it as magnesium threonate, magnesium L-threonate, or MagTeen, which is its trademarked name. So what makes magnesium threonate unique is that it's the only form known to effectively cross the blood-brain barrier. What does that mean for you? It means that it can directly affect your brain health. Think improved memory, sharper focus, and better mental clarity. If brain fog or struggling to remember things is something you deal with, magnesium threonate might be your best bet. Studies show that magnesium threonate can significantly improve both short and long-term memory, making it a fantastic option for anyone wanting to boost their cognitive function. Animal studies even suggest that it can protect against conditions like Parkinson's disease by reducing motor deficits and nerve cell loss. Magnesium threonate has also been shown to increase the density of synapses in your brain. That means it improves how effectively your neurons can communicate. Do you ever feel like your energy is just drained? That's where magnesium malate comes in. So this type is bound to malic acid, which is involved in energy production. It helps create ATP, which is the energy currency of our cells. This makes magnesium malate a great option for people with chronic fatigue or muscle pain, and it's often recommended for those with conditions like fibromyalgia. So in studies, magnesium malate has shown improvements in red blood cell magnesium levels and symptoms associated with deficiency. And although not heavily researched, many people do report reductions in pain and tenderness, likely because it supports muscle function and energy production. Now let's talk about magnesium oxide. Magnesium oxide is probably the most common form you'll see on the shelves, but it's not the best for everyone. It's got lower bioavailability, which means it's harder for your body to absorb. However, it's got a high concentration of elemental magnesium, which can be useful if you're dealing with a severe deficiency. It's just not that practical, so I don't typically recommend it on its own unless you're using it for one particular issue. Magnesium oxide is a strong laxative, so if constipation is your main issue, this might be the one for you. The way it works is as an osmotic laxative, which means it's drawing water into your intestines to soften stool. There are also some studies that suggest that mag oxide can help reduce the risk of dementia, which is kind of interesting to me because, as we talked about, it's not that bioavailable, but this is what the studies have shown. And some experimental studies have shown that it can help prevent certain types of colonic injury. So back to how oxide and the gut are very much hand in hand. Now I want to talk about magnesium chloride. This formulation of magnesium is often used in topical applications like oils and sprays. And if you've got some sore muscles or cramps, applying magnesium chloride directly to your skin can help them relax and recover. It's also absorbed quite well when taken orally, and some find it a great option if they're having trouble with other oral magnesium supplements. Oral magnesium chloride has shown benefits for people with metabolic syndrome, improving their blood pressure and glucose levels. It's also been found to reduce symptoms of mild to moderate depression and anxiety, so it's a strong candidate for people looking to support their mental health. If heart health is your main concern, you might want to look into magnesium taurate. This form combines magnesium with taurine, which is an amino acid known for supporting your cardiovascular health and calming your nervous system. It's a fantastic choice for anyone looking to protect their head and heart and keep their blood pressure in check. Magnesium taurate has been found in studies to have anti-hypertensive, anti-arrhythmic, and antithrombotic effects, making it a great option for heart health. It's also been shown to prevent hypertension-induced cataracts in some experimental studies. Magnesium orotate is another standout when it comes to cardiovascular health, but it shines in a slightly different way. It supports energy production at a cellular level and is popular amongst athletes for its ability to enhance endurance and performance. Studies have shown that magnesium orotate can help improve survival rates in patients with severe congestive heart failure, which is significant for those managing serious heart conditions. And for athletes, like I mentioned, it does improve performance, reduce fatigue, and support better recovery times, making it a great companion for your workouts. And we can't forget about Epsom salts. These are a classic, made of magnesium sulfate, and they're mostly used in baths to help soothe sore muscles. I know in the bathhouse that I go to, there's actually a salt bath, and I believe what they're using is the Epsom salts, and they're absorbed easily through the skin, which makes them a good option for people who have trouble with oral supplements. Just be cautious, as ingesting too much or absorbing too much through your skin can lead to serious issues like hypermagnesemia, which is an excess of magnesium in the blood. Most of us will be able to deal with excess magnesium without any trouble because our bodies are evolved for that. But if you are particularly sensitive or you have heart issues or kidney issues, you might want to look out. Some interesting things have come up in studies. It turns out that Epsom salts are also used as an osmotic laxative, but they should be used with special care to avoid severe electrolyte imbalances. And it's generally safe for short-term use, but prolonged exposure has been shown to have cytotoxic effects in studies, so it can actually kill off your cells. So it's best not to overdo it. With all of these options, how do you choose the right one? The answer depends on your specific health goals and needs. Like we mentioned, there are so many different considerations, but I want to go through a few simple guidelines to help you decide. If your primary goal is to reduce anxiety, improve sleep, or wind down more effectively, magnesium glycinate is a great choice. This form is gentle, calming, and unlikely to cause digestive issues. If you're more concerned about brain health or struggling with focus and memory, magnesium threonate is worth considering. It's the only form that's been shown in studies to directly cross into the brain and can directly influence our cognitive function. If you're experiencing chronic fatigue or muscle soreness, magnesium malate is fantastic for supporting energy production and muscle function, making it great for those with fibromyalgia or similar conditions, or simply if you're using your muscles a lot, like if you're an athlete. If constipation is your main issue, magnesium citrate or magnesium oxide can help get things going. Just be mindful of the potential for severe digestive upset with higher doses. And if you're focusing on heart health, magnesium taurate or orotate can be very beneficial as it provides extra support to your cardiovascular system. If you just want relief for sore muscles or don't like oral supplements, magnesium chloride oil or Epsom salts, which are made of magnesium sulfate, can be applied directly to the skin or used in baths to provide that localized relief and promote muscle relaxation. Remember, there's no single best supplement for everyone. It's all about understanding your body and matching the right form to your needs. Now let's talk about dosage. It's always important with dosage to start low and work your way up. Everyone's body responds differently, and it's important to listen to what your body's telling you. Talk to your doctor, especially if you have existing health conditions or you take medications that could interact with magnesium. Magnesium is a true all-star mineral, and getting the right form can make a world of difference in how you feel. So we've talked about the different types of magnesium and how each can help in different ways. Now it's time to answer the next big question. How much magnesium should you take and how often? This part is very complicated, and I'll try to help you understand dosage and timing. I'll also provide some practical tips to make sure you're getting the most out of your magnesium supplementation. The recommended daily allowance, or RDA, for magnesium varies depending on factors like age, sex, and lifestyle. For adults, it generally falls between 310 and 420 milligrams per day. But here's the thing, that's just the general recommended daily allowance, which, as we've learned, if you've been listening to many of my other episodes, is just a general guideline. And it really is not appropriate for every single person to follow this super generalized guideline. Your needs are going to vary significantly depending on your health goals and whether you're deficient or not. So when talking about magnesium supplements, it's essential to understand elemental magnesium versus total compound weight. So elemental magnesium refers to the actual amount of magnesium in the supplement that your body can use. Different forms of magnesium contain varying amounts of elemental magnesium. For instance, magnesium oxide has a high concentration of elemental magnesium, about 60%, while magnesium glycinate has a lower concentration, around 14%. However, the form of magnesium also determines how well it's absorbed. While magnesium oxide has this high elemental content, it's also less bioavailable, meaning your body is not going to absorb it as efficiently as forms like glycinate or citrate. So someone sent a message, can taking any magnesium be beneficial to most of these symptoms? I would think about it in two ways. First, there's the bioavailability. So for most people, you want to increase your bioavailability rather than, not have bioavailability. But then it also matters like what you're using it for. And magnesium oxide and citrate are just kind of interesting because they help with your bowel movements. And it does so because it's actually less bioavailable. So it's actually just just going into your gut, it's pulling water in, and then you're having those bowel movements because it's actually less bioavailable. On that very topic, I wanted to talk about some examples of different types of supplements and whether or not they're going to be more or less bioavailable and what that means for you. Here's a quick example. A 500 milligram tablet of magnesium citrate doesn't mean you're going to get 500 milligrams of elemental magnesium. Magnesium citrate is only about 16% elemental magnesium, so that 500 milligram tablet contains roughly 80 milligrams of usable magnesium. Understanding this distinction is key to getting your dosage right. Luckily, most supplements are going to tell you the amount of elemental magnesium, so you can just look at that number. Magnesium supplementation protocols vary depending on your need and your health goals. Here are some key protocols we know based on current medical literature. So if you're someone dealing with chronic constipation without any other known cause, you can use magnesium oxide. The dose of that for chronic constipation is 1.5 grams a day. You can also use lower doses of 500 milligrams a day, which might be enough for your particular symptoms. For blood pressure reduction, a systematic review suggests that magnesium supplementation at doses of 360 milligrams per day for durations greater than 3 months can effectively reduce systolic blood pressure. I often tell people the great thing about magnesium is you can feel the results rather quickly. But for something like blood pressure reduction, because it's causing all of these system-wide effects, it can take a little bit longer. So that's why the mention of 3 months or longer of supplementation is helpful. And for folks dealing with mood issues, a randomized controlled trial showed that 500 milligrams per day of actually magnesium oxide, which, as we talked about, isn't super bioavailable, for 8 weeks did significantly improve depression status if they already had a deficiency. So you can imagine, even though there wasn't a direct study on it, different, more bioavailable forms of magnesium would probably have an even greater benefit, perhaps in a short amount of time. But we just don't have enough studies to talk about a lot of different specific use cases, which is why it's hard sometimes for doctors to recommend a specific protocol. And for someone dealing with stress or sleep issues, you might want to aim for 200 to 400 milligrams of elemental magnesium. And like I mentioned before, typically this is going to be as magnesium glycinate. And you want to take it in the evening in case it affects you quite quickly. If you're looking for the cognitive support, a similar range of the elemental magnesium of about 400 milligrams per day in the form of magnesium threonate can work well. But this has been studied much, much less in the literature so far. So it's important to just start at a lower end and see how your body responds. Magnesium for digestive health, like citrate or oxide, tends to have a laxative effect fairly quickly. So I typically recommend that people should start lower, like 100 to 150 milligrams of elemental magnesium, and adjust upwards as needed. And listen to your body, especially your gut, because your gut is going to give you clues if you're taking too much. So when should you take magnesium? Magnesium is best absorbed when taken with food because it can cause stomach upset when taken on an empty stomach, especially for those less bioavailable forms that we talked about, like magnesium citrate and oxide. For sleep and relaxation, taking magnesium in the evening is a good idea because it'll help calm your nervous system and prepare your body for rest. On the other hand, if you're using magnesium for energy production, like magnesium malate, taking it in the morning can give you a gentle energy boost. More frequent dosing of magnesium supplements throughout the day can also be helpful for improving absorption and minimizing side effects. So instead of taking one big dose, try dividing your magnesium intake into 2 or 3 smaller doses spread throughout the day. This strategy has been shown to increase the bioavailability and reduce GI effects like diarrhea. Scientific studies also show that the smaller, more frequent doses significantly increases magnesium absorption and retention compared to the larger, less frequent doses. Spread out your magnesium intake to make a big difference in how it's absorbed. If you are particularly concerned, you can even look for continuous release formulations. But I find practically that dividing your doses is enough to provide that steady supply of magnesium throughout the day. I know it can be confusing to keep straight all of the different formulations of magnesium supplementations with the different needs. I find it's practical sometimes to take a combo magnesium supplement like a B complex, except it's a magnesium complex of a kind. I do recommend talking to your doctor because it's going to have interactions and implications for the rest of your health, especially if you're already taking other medications and supplements. I know some serious biohackers who want to time everything down to the minute and they take magnesium malate in the morning for that energy boost boost, magnesium glycinate in the evening for relaxation, and maybe even some magnesium spray as needed for sore muscles. I think that's a little bit much for most of us, but that approach can help you leverage the unique strengths of each type of magnesium. The overall summary of dosing and protocols is to start low and go slow, especially if you're new to magnesium or really any new medication or supplement. You want to start with a lower dose. This will help your body adjust and prevent digestive side effects like loose stools if that's not what you're going for. If you need a higher dose, it's a good idea to divide it into 2 or 3 smaller doses throughout the day. This will help with absorption, but also reduces the risk of side effects like the GI discomfort. Magnesium absorbs better when taken with food. Plus, this reduces the chance of the GI side effects again. Also, you're going to want to hydrate well. Magnesium, particularly forms like citrate and oxide, can draw water into the intestines. So you make sure you want to drink enough water to stay hydrated, because otherwise you're going to take it away from your veins and it's going to go straight into your gut, which is helpful for having bowel movements, but it can lead to less circulatory pressure for the rest of your body. And if you have a sensitive digestive system, you can consider the topical magnesium chloride sprays or Epsom salt baths as an alternative to the oral supplements. They're great for the sore muscles and they can avoid any gut-related issues. So magnesium is generally considered safe, but there are a few groups of people who should be extra cautious and should definitely work with their doctor when considering supplementation with magnesium or really anything else. If you have chronic kidney disease or impaired kidney function, your body might have trouble clearing excess magnesium. So this can lead to hypermagnesemia, which can be dangerous. Symptoms of hypermagnesemia include hypotension, that's low blood pressure, facial flushing, nausea, vomiting, muscle weakness, and in severe cases, cardiac arrhythmias and respiratory depression, or the slowdown of your breathing. Talk to your doctor for sure if you have kidney concerns. Some medications can also interact with magnesium, including antibiotics, diuretics, and certain heart medications. Magnesium can reduce the effectiveness of these drugs by binding with them in the digestive tract. So talk to your doctor or a pharmacist if you're unsure whether magnesium is safe to take with your medications. Magnesium is known for its ability to relax muscles and lower your blood pressure, which typically is beneficial. However, if you already have low blood pressure or hypotension, taking too much magnesium can actually make you feel lightheaded or dizzy. So it's better to start with a lower dose and monitor how you feel. Finally, pregnant women should always consult their healthcare provider before adding supplements, including magnesium. While it's often recommended for things like leg cramps during pregnancy, it's important to find the right type and dose to avoid complications. And in the context of antenatal magnesium sulfate administration, while serious maternal adverse effects like cardiac arrest or respiratory arrest are not typically increased in studies, there is a risk of minor adverse effects that may lead to treatment cessation. So like I mentioned, it's good to be aware of the signs of taking too much magnesium. Symptoms include diarrhea, nausea, abdominal cramping, and in severe cases, irregular heartbeat or low blood pressure. These symptoms are more common with magnesium oxide or citrate, which have higher laxative effects. If you notice these signs, cut back on your dosage or switch to a form that's gentler. Magnesium is a versatile and powerful mineral, but like any supplement, it needs to be taken thoughtfully. Finding the right type, dose, and timing for your individual needs can make all the difference. So whether you're looking to sleep better, boost your energy, or support your heart health, getting your magnesium dosage right is key to unlocking its benefits. And remember, more isn't always better. Sometimes it's about finding the sweet spot that works for your body. And as always, when in doubt, check in with your healthcare provider to make sure you're on the right track. At this point in today's episode, your mind is probably spinning with all the different types of magnesium supplements. Now I'm going to go over a framework I use in my own practice to think about magnesium supplementation for different types of needs. First off, research shows that if you're generally healthy, most magnesium forms can maintain adequate levels. So you don't need to overly obsess about which form you take. However, if you are an older adult or you have a clear deficiency as shown by a red blood cell magnesium level, you want to choose forms with higher bioavailability to ensure effective absorption. Otherwise, align the form of magnesium supplementation with your particular health goals. That is, sleep, energy, digestion. So let's walk through the simple framework. I call this the 2 axes of magnesium. It's designed to help you choose the right form of magnesium based on 2 things. First is bioavailability, how well your body absorbs the magnesium supplement. Two, its targeted benefits, what the particular form of magnesium is best for, such as sleep, digestion, or energy. First, let's talk bioavailability, or how easily your body absorbs a particular form of magnesium. Some forms are highly bioavailable, meaning they're better at increasing magnesium levels in your body at a particular dose. Others pass through your digestive system with minimal absorption. Let's break down the different forms of magnesium and how it impacts bioavailability. Magnesium supplements fall into two categories, organic and inorganic. This is based on the molecule that the magnesium is bound to. In organic forms, magnesium is attached to a carbon-containing molecule, such as an amino acid or an organic acid, like citrate, glycinate, or malate. These forms are typically more bioavailable, meaning your body can absorb and use them more effectively at a given dose. In inorganic forms, magnesium is attached to a non-carbon molecule, such as oxides, sulfates, or chlorides. These are less bioavailable, but can be effective for specific purposes, like digestion or muscle relaxation. So why are organic forms better absorbed? It's because organic molecules mimic natural compounds your body encounters in food. For example, magnesium glycinate is chelated or bound to two glycine molecules. These are amino acids that enhance absorption and reduce stomach upset. Inorganic forms, such as magnesium oxide, tend to have lower solubility, meaning they're less readily absorbed. The biggest takeaway here is if you want better absorption and long-term benefits from magnesium itself, stick with the organic forms. Inorganic forms can still work well for certain quick fixes, such as occasional digestion or muscle relief. Now here I want to show you a quick table showing the estimated ranking of bioavailability of the different forms of magnesium. The reason this is just an estimate is because different studies have varied results depending on their specific protocols for testing bioavailability. Plus, some forms are very dose specific, meaning they're more or less bioavailable depending on how high you go with the dose. As you can see, magnesium glycinate or bisglycinate, which are, remember, the same supplement, is the most bioavailable form by far. Magnesium malate is also highly bioavailable. Then we see magnesium L-threonate, also known as magtine, which is specifically highly bioavailable in the brain. There are numerous moderately bioavailable forms, including magnesium lactate, which I added to this table because you'll see it on supplement shelves, but don't really have a specific targeted use. And then you get to the least bioavailable, which is magnesium oxide, with just about 4% bioavailability, so it's used as a laxative. And also we have Epsom salts, which we primarily use in baths in a topical form or in the IV form in hospitals, making it more bioavailable. The second axis we use for choosing the right magnesium supplement is the targeted benefits axis, or what the specific form is good for. Because there are so many, I have included some mnemonics to help you remember the different forms and their targeted benefits. Let's start with magnesium bisglycinate, the gold standard for magnesium supplements. This form is highly bioavailable, which means your body absorbs it very effectively. It's best known for supporting sleep, anxiety, and relaxation because it's calming and gentle on the stomach. To remember this, remember B is for bisglycinate and for better sleep, balance, and bioavailability. If you're struggling with stress or poor sleep, bisglycinate is an excellent choice. Next, we have magnesium malate, which is fantastic for energy and muscle recovery. Magnesium is bound to malic acid in this form, which helps produce ATP, your body's energy currency. This makes it perfect for people dealing with fatigue or post-workout soreness. So remember, M is for malate, which is also for muscles and mitochondria. If you're looking to boost energy and recover faster after exercise, malate is your go-to. Magnesium threonate is unique because it crosses the blood-brain barrier more effectively, making it the best choice for brain health and cognition. It's ideal for improving memory and focus. To help you remember, T is for threonate and for thinking. If you're experiencing brain fog or want to enhance your cognitive performance, magnesium L-threonate is a great option. Magnesium lactate is an excellent choice for general supplementation. It's gentle on the stomach, making it a good option for long-term use and maintaining magnesium levels. L is for lactate and long-term use. If you need a steady, reliable magnesium source without targeting a particular issue, lactate is a solid pick. Magnesium citrate is best known for its effects on digestion and constipation relief. It works as a gentle laxative, keeping your bowel movements regular. To remember this, C is for citrate and for constipation. If you're dealing with digestive issues, citrate is an effective and accessible choice. Magnesium chloride is versatile and works well for cramps and muscle relaxation. It can be taken orally or absorbed through the skin using magnesium oil. This is confusing because it's also a C, but you can remember C is for chloride, which is also for chilling and for cramps. So for muscle tension and soreness, magnesium chloride is a great all-purpose option. Magnesium taurate is the go-to for heart health. It combines magnesium with taurine, which is an amino acid that helps regulate blood pressure and heart rhythm. T in magnesium taurate is also for your ticker. If cardiovascular health is your priority, taurate is the form to use. Magnesium orotate supports cellular energy and endurance, making it popular amongst athletes. It helps improve mitochondrial function, which powers your cells. O is for orotate and for Olympians. So if you're looking to boost your endurance or performance, magnesium orotate is worth considering. Magnesium oxide is poorly absorbed, but is effective as a strong laxative for occasional constipation relief. So you can think of O is for oxide and for occasional relief of constipation. It's really not ideal for long-term supplementation, but useful in a short-term emergency. And finally, we have magnesium sulfate, known to most people as Epsom salts. It's primarily used in baths for muscle relaxation and soreness relief, and it's absorbed through the skin. So remember, S is for sulfate and for spa days and salts. So if you're dealing with tight muscles or want to unwind, a soak in Epsom salts is a fantastic choice. I know that was a lot of information, but magnesium is such an important mineral with so many options to consider that it's worth taking the time to get it right. So whether you're looking to sleep better, boost your energy, support your digestion, or care for your heart, there's a specific form of magnesium supplement that can help. Use this guide to choose the right one for you, and feel free to comment if you have a particular question or if you want to share your experience with the magnesium. And as always, thank you for listening. If you found it helpful, share it with someone who might benefit from learning more about magnesium. Next, we'll talk about a new supplement that you might have seen in the health sphere and which has become incredibly popular among longevity physicians.